Thank you for joining us on Health Diary. My name is Gladys Gachanja. Now, the 2nd of April, a day set aside to spotlight on the challenges those living with autism and their caregivers have to face. It also is our subject of conversation today, even as we try to get to understand it better and also understand the support system those living with the condition need. But before we get to that conversation, here now is a fact of the matter. Autism or autism spectrum disorder refers to a range of neurodevelopmental disorders characterized by challenges with social skills, repetitive behaviors, speech, and non-verbal communication. Because autism is a spectrum disorder, each person with autism has a distinct set of strengths and challenges. Some people with autism may require significant support in their daily lives, while others may need less support and in some cases live entirely independently. In 2018, the World Health Organization estimated that 1 in 160 children has an ASD worldwide. Globally, access to services and support for people with autism is inadequate.
During pregnancy, everything was okay. In fact, I never felt any difficulties like headache, the vomiting, they were not there up to the day that I went to deliver. So it was like 4 centimeters the whole day, in fact 2 days. When I was in the waiting room now to enter the theater, then the baby's head came out. So they were like, we cannot rush him in for her in for theater because your kichwa imeanza kutokezea. When the baby came out, he never cried. When he was in the nursery, the second day he convulsed. From there akawekwa on drugs, the anticonvulsive drugs plus some antibiotics. I used to go for the review like twice per month. Later it was once per month for up to 5 years. But when he was 3 years, I stopped the drugs because it was very expensive. At 3 years, he could not sit still properly. The head, ukimbeba, kichwa ilikuwa inaanguka huko. So you could not even carry him on your back. Unambeba kama mtoto wa like a month. The legs were still weak. Everything was just weak on him. Actually, the dad was so supportive. Tulikuwa tunanaye tunaona what the doctor anafanya. Tukifika nyumbani sisi tunafanya. Later on, he advised us kumpeleka shule at least apate hiyo company ya watoto wengine because alikuwa rough, angeza ataka. Other head teachers walikuwa rough, wanakuongelesha is like kwa hii shule yetu hatutaki abnormal kids. So from there ndio nikampeleka SK St. Monica in Utawala. For the time ameona huyo speech therapist kumekuwa na improvement because he can count 1 to 10, anaita mom, maji, nataka kususu, nataka kupupu. So mimi ninge request, sijui kama ni the government ama the doctors wangekuja na a cheaper way of maintaining these kids. Ikuwe kama hao wenye wako na ARV, imekuwa sama affordable. Hata hiyo nini, hii dawa za convulsions ikuwe affordable.
Well, autism is a lifelong condition, but those living with autism with the right care, they can live a fulfilled and active life. Well, how can this be possible? How can the society and their caregivers ensure that this is a possibility for them? To understand this more, let's find out from James Gatenga, who is a father to a 5-year-old daughter and actually comes from Kisii. Thank you for joining us. And Dr. Pauline Samir, who is a neurologist. Thank you for your time. Now, I'll start with you, Daktari. Is autism the same as autism spectrum disorder? Let's just clarify that.
Yes, and the reason why it's called a spectrum is because that's exactly what it is. So there are children who you will find that they're probably not very sociable, but they get by, they're fine, they go to school, they understand numbers, they in fact love reading and doing things on their own. And there are others who have severe symptoms, they need help with most things, they cannot deal with change. So that is why it's called a spectrum disorder.
Does it now point on the different types of autism?
Yes, we used to subdivide the classes, you try and talk about the severity using various different descriptions. We no longer do that. We give a diagnosis of autism spectrum disorder, then we try and determine what is the level of disability for this child. Why? Because that directly then affects how much help or how many interventions or how much facilitation the child needs.
Most autistic people are diagnosed at a younger age. Gachanja, you have a 5-year-old daughter. When was she diagnosed?
She was diagnosed when she was 2 years, 1 month. That was 2015, December. Initially, we were treating something different. We thought maybe our daughter was partially deaf. So that was what we were treating. But the telltale signs that we had, she could not respond when we were calling. She could not say even a word. Some stages were not achieved at the right time, like crawling, walking. She took longer as compared to the other children.
Dr. Ari, the symptoms vary from one patient to another. What are the common symptoms that can tell you something is off?
Yes, that could lead to not really misdiagnosis. The biggest problem is missed diagnosis. The diagnosis is not made at all in the first place. That's usually, I think, our biggest problem, especially in this country or in this region. And the danger with that is then the correct interventions do not get put in place when they should be put in place. Remember, you're born with a relatively immature brain. So of all the parts of you, like your eye never changes size all your life, but your brain is not like that. Your brain develops, and about 85% of physical brain development is completed before age 3. So at that point in time, between 0 and 5 years of age, we consider that to be the most sensitive period for the development of most of your senses. And that's when most of the foundation is laid, and the rest of your life it's fine-tuning till you're probably 25. So receiving a diagnosis early is very important, because then we can intervene at a point in time when your brain is still sensitive and able to potentially respond to the intervention.
Some of those symptoms that you're talking about, and he touched on it, are delayed speech development, rejecting cuddles, in some cases hyperactiveness, which sound like any other child going through the young stages of development. So what should parents be keen on?
So some of the symptoms that you may notice in a child before age 2 is lack of eye contact. And eye movement, eye contact starts as early as 6 weeks after delivery, right? So for a child not to be looking at you, either they're visually impaired, right? But how you know they're not visually impaired is because other things then attract their attention. Sometimes you give a social, what we call a social smile, a smile, I'm smiling at you directly. The natural thing is that you smile back at me. And some of them actually develop all these things normally. Then at about 18 months, for no apparent reason, they begin to regress. Some of them lose words they used to have, they lose habits they used to have, and completely now deviate from the normal developmental trajectory. I think it would be the biggest red flag.
Do you have autism in your family?
My child is the first one. We don't have autism.
At all?
In our family, we don't.
Okay, so at this case, I would like to know, how was it received then?
I'm blessed and I was lucky because we have a family that believes in God. So when I told them there's this condition that we have been told, they said one thing: it's okay, go back to the doctor, let them tell you what is the medication. So I went back the following day, they told me there's no medication. Then they said there is something called, they told me speech therapy. I start with speech therapy. When I communicated, they said, okay, no problem. Let them tell you what we need so that you can start as early as possible.
Okay, from a scientific point of view, we know that yes, genetics plays a huge part. And it could just be that this particular individual has a genetic makeup that differs from the next child or from this sibling by maybe even just 1 point within the whole of their genetic makeup, you know. It could be something minor like what we would call like a deletion, you know, one gene or, you know, one gene in the chromosomal makeup is missing or is inverted or is just sitting in the wrong place. Minor, tiny changes like those sometimes lead to this sort of presentation. So most of us actually carry aberrations that don't affect us. But it's just when they're passed on to our children, and maybe there is a change. For example, you lack oxygen at birth, you know, you have a difficult delivery. Sometimes it's what the environment does to the person that leads to the expression.
For you, James, I'm sure you said you had a family that was very supportive, but away from the family, there's also, you know, society, there's school. Was there any stigma that you dealt with?
I come from Kisii region. In Kisii region, there's this thing called witchcraft and curses. Actually, a big percent of our population believe in witchcraft. Any disability, any misfortune that you face is associated with witchcraft. So the big question is then asked, who is cursed among you? Is it you or is it your wife? So if you come from a family that is not supportive or understanding, many families end up chasing the wife. Kwamba, this is from your side of your family. So take this problem to your family. So many families end up disintegrating because of that.
There are people who say you can also say it is because somebody drank when they were pregnant or they fell when they were pregnant. So myths or fact? Clarify even as we take a break.
Yes, I know there are all sorts of myths, and most myths come from a point of lack of understanding. When a diagnosis is not made, when people can't explain what is going on, that is when then we look for supernatural answers. So what the environment does is basically modify. Yes, it's true, we have things like fetal alcohol syndrome, where the child may present with delayed development and usually hyperactivity or ADHD. So yes, the environment may play a part, but almost always there is something in that person's genetic makeup that makes them more susceptible to developing autism spectrum disorder than the rest of the population. Sometimes we can't find out what that change in the genes is, but almost always it's there.
Okay, a good clarification there. When we come back, autism can also be diagnosed at adulthood. So how is it that somebody can live through their whole life and only find out that they're autistic at that age? That answer coming your way right after this break. Welcome back. Well, autism is a reality for many, and the good news is that those living with autism can actually live a fulfilled, active life. So we are trying to understand how this can be made possible, and we still have Dr. and James on set to help us with that. Now, I'll start with you, Gachanja. There's some measures you took when you found out your child was living with autism so that they can be able to live a fulfilled life. What are some of those?
I started by removing all the unwanted foods because I was told diet is very important. We never used to take care of diet. We used to give her everything and anything. Another thing is to change our attitude. For example, I used to be an impatient person. Thanks to my kid, now I'm patient, because without patience, you cannot really understand your kid, because she's trying to explain something, she's trying to tell you something, but because you don't know, you have to be patient to get what she's telling you.
Dr. Caregivers, society, teachers, relatives, what should be our priority in terms of giving the right interventions?
There is nothing like one size fits all. Each child is an individual, and we've got to address what ails the individual or what the problem is with the individual. So for children who are very hyperactive, we have noticed that for some children, just being on wheat, dairy, lots of sugary foods, lots of processed foods, they are more hyper and less attentive. We've had children who just dietary modification led them to being more calm and able to be taught. For other children, they have required not just dietary intervention, they have also required occupational therapy. Why? Because with occupational therapy, they do what we call sensory integration, or basically regulating your senses, because some children, they're always looking for excitement. They're biting things. They're looking for ways to excite themselves. Sometimes it's self-soothing behavior. Sometimes it's what we call fine motor function. And then finally, when they're settled and now they can pay attention, a majority will also benefit from speech therapy. And sometimes speech is not just about teaching them language. Sometimes they have the language. It's the way they use it and the frequency. There is no medication for autism, but what we know is that children who receive interventions earlier in life, they generally do better along the trajectory.
I like the fact that you brought up the education bit, because it's one of the biggest challenges when it comes to autistic children.
We are lucky to have one special school in Kisii, but as much as it is there, is it offering appropriate learning for these autistic kids? That is the biggest challenge. Yes, they might be there, but they are not equipped. They are not, they don't have the right human resource, even the attitude itself.
I understand that only about 2% of children with special needs are currently in school, leaving a huge spectrum of them out of it. What are some of those early interventions and infrastructures that should be set up to support these children?
We actually have an ethical and moral obligation to make sure that they get an assessment that advises appropriate school placement. There are kids who, yes, their verbal communication and social communication is not too great, but they're not aggressive, they're not hyperactive, they can sit in a regular class and learn. Then there are children here in the middle, which is where we have the greatest need and deficit. There are children who, yes, the young man is 8 years old, but he is operating at a 5-year level. So what to do with that child? You can't give him work that is suitable for an 8-year-old or a 10-year-old. He will not make it. But if you teach him and give him work for a 5-year level, he does it perfectly okay. So finding teachers who are motivated, who are supported to do their work, and who can cater for these kids who are in between, needing learning support, I think that's where we have their greatest need. For children who have significant intellectual disability, those are children who don't speak, probably maybe walked at age 6 or 7 years or something like that. You can see even the intellectual functioning is really, doesn't even allow them to live independently. And for them, it's about socialization, maybe getting their occupational therapy, their physiotherapy, those kind of things. So those kind of schools, they exist. I think that the biggest need is in between.
Another uphill task, the expenses that goes into the management of autism. I'm talking about the medical costs. How does that look like?
The expenses are huge. For example, we need to buy supplements for these kids. We need to buy alternative foods, because already we have been told, do not use this and this and this and this. Apart from being expensive, they are unavailable. When it comes to speech therapy, occupational therapy, we need those services frequently. But because they are expensive, they are not even available from where I come from. We end up getting maybe 4 sessions a month. It's not even of help. But in terms of NHIF, we really need to call upon them so that they can accommodate the therapy sessions in their NHIF.
Does insurance take this up? Private insurance?
Private insurance, very few. And they only say up to a certain level. after they get maybe the assessment from a doctor. And most of this insurance, the sad part of it is they don't know what is autism. So they will say, we cannot cover this condition because we don't understand this condition.
Through the hospital that I work for or work with, NHIF has been helpful in diagnosis. For example, when you need an MRI brain done, when you need, for those with convulsions, an EEG done, sometimes even blood works. Yes, we have seen those who are covered get assistance in that way. So I think it's not 100% there is nothing. But when it comes to the therapies, I must admit that there is a challenge there. One, it is expensive. On average, most sessions will be anything between 2,000 and 3,000. So you can imagine if a child needs 3 occupational therapy sessions every week, minimum, right? And we don't know sometimes for how long. It could go on for 6 months, it could go on for a year. So it is a huge investment.
How can the county governments come into this? Because, I mean, health is now devolved, and clearly things like occupational therapy is needed at the grassroots because they can't keep coming to Nairobi for this help. What would you suggest?
What I would advocate for, even in all hospitals, is multidisciplinary team settings. For example, you come in and there is a nutritionist sitting in the room, there's an occupational therapist, there is a speech therapist, and as and when required, maybe a special education teacher. So you're all looking at this child, different aspects according to your training and your interest, or rather, you know, your contribution to the child at the same time. So if there is one charge for the MDT, right, especially so through government facilities, then it is one charge. So maybe you've come in, the hospital charges you, for example, 3,000 shillings, but in that time, all these people get to see you, put in their interventions, and I agree, speech therapy cannot run at the same time as occupational therapy. But if there is one standard billing, done for that MDT team, then it would help families to cope.
Okay, Gachanja, you plan to cycle from Nairobi to Kisii through 15 counties to raise money to at least equip the Occupational Therapy Center in Kisii. Yeah. How do you intend to do this, and why is it important to do this?
Let me start with the why. I, with other parents in Kisii County, we decided enough is enough. Coming to Nairobi for the services is no longer working. So we joined forces. We started a center called Dazzling Center for Autism. So in the center, we get a special needs teacher who will give a tailor-made education plan for each and every child. At the same time, we have an occupational therapy. But because of the expense part of it, we tell him come part-time. The speech therapy, unfortunately, we don't have speech therapists. So the one that we can have access to is from Kericho. So you can imagine how expensive it is, and even the frequency. The reason as to why I will be doing the cycling, one is to create awareness. Through the awareness, people will come to understand the myths associated with autism will at least subsidize kidogo. Then we will be also looking at raising funds. The funds will go a long way to enable us equip the occupational therapy so that our kids can access the services that they need.
Okay, well, definitely a great initiative, James Gachanja, for the 5-year-old daughter who hails from Kisii, and Dr. Pauline Samir, who is a neurologist. Clearly, a lot of those who are living with autism need a lot of support going forward for them to live a fulfilled and active life. Well, that has been our conversation for today, but here now is the health tip.
Health tip brought to you by Good Life Pharmacy.
I'm here to tell you about the role of a pharmacist in managing hypertension. Hypertension is a silent disease that doesn't come with any symptoms. Statistics have shown that 70% of Kenyans seek their first medical consultation through pharmacies. Anytime you come for any review, either to buy your core medicine or to fill any prescription that the doctor has written, it's good to ask your pharmacist to do a hypertension test, a BP test. The best option is actually to purchase a BP machine so that you can have your test at home. Most importantly, you should not get off medication unless you're advised by your doctor. From the patient's perspective, it's important to maintain their healthy lifestyle. This would include reducing the amount of salt in your diet, exercise, avoiding smoking, and having constant tests.
Health Bite, brought to you by Good Life Pharmacy.
I'm here to introduce to you our Fabia blood pressure machines, which are two in types, one for the upper arm, the other one for the wrist. And I'll show you very fast the special features we have. The first one is the upper arm one. The most interesting features that we have is that it has the voice broadcast, whereby from the time you begin your measurements to the end, it talks and interprets for you the results.
Attention, please. Please keep silent and relax. Keep the cuff at heart level. Start measurement now.
So even for the visually impaired patients or people taking their measurements, they're able to hear, and the interpretation is also heard to them through the voice broadcast.
Your systolic blood pressure is 109 millimeter of mercury pillar. Your diastolic blood pressure is 66 millimeter of mercury pillar.
Another feature it has is that there are two options. You can be able to use the batteries, and at the same time it has an external power port whereby you plug in your normal USB charger and you're able to use it directly on power, while it's on power. So another special feature is it's affordable, and you can be able to find it in most of the stores around the country. There's a cuff that is bought separately for the people with the bigger upper arm. So you are able to buy it and fix it in the normal machine that maybe you may have at home. Or maybe if you have a friend who needs to use it, he has a bigger upper arm, you can be able to purchase this bigger size cuff and use it as well. We also have the wrist one, which comes packaged like this. In a good way, you can travel with it easily. So it also has this special feature of voice broadcast, whereby it interprets for you the results.
According to the World Health Organization standards, the measurement result is normal.
And at the same time, you can see it on the screen. There's also one point about both machines, both for the Fabia blood pressure machine for the wrist and the upper arm. There's a feature for two users, whereby when you switch it on, you'll see the option of choosing user A and B. So when you have two hypertensive patients at home, and you can follow up your readings whenever you have, because it has memory. So the memory feature that is in it also, it helps you keep your record. Even if you are using two people at home, you are able to keep your records well. So I would recommend everybody who is hypertensive, those who go for fitness centers, to have one for themselves, Fabia blood pressure machine, which have special features that they can be able to use and feel comfortable wherever they are.
Health Bite, brought to you by Good Life Pharmacy.
Thank you for your suggestions and your comments coming through to us on our social media handles. My name is Gladys Gachanja. See you next time.